my patients don't really have cold-blooded kinds of impulses. When they get psychotic or they get manic or they get addicted, they may do bad things, but they're not that cold-bloodedness. My hair stands up in the back of my neck still when I think about that video. And yet this person didn't continue shooting. They just shoot a couple of times. I thought it was going to be, based on that video, I thought he had potential to do just tremendous damage. What do you think happened there when he just stopped and shot himself? I guess we were led to believe that's what happened.
Yeah, I mean, I don't know. Obviously, I think anyone who claims to know, is a little maybe psychotic themselves, I guess, as far as being outside of reality. I mean, I certainly don't know. However, I do think it's really important that we study exactly what medications he was on. And I don't even just mean whatever medications were part of this, trans plan, but, maybe there's even something as simple as SSRIs, and maybe there's drug interactions. Yeah. Also, this person obviously did not even feel comfortable discussing with his own medical team that he was not feeling on board with his own plan. So that tells me that he was in a great deal of isolation. It suggests, maybe he was obviously having trouble communicating. And again, it's part of my whole interest in free speech is we know that when people are prone to violence, the first thing we want to do is help them learn to use their words. We want to teach them to speak their mind, no matter what it might be, so that they don't act out in violence. I can't help but wonder on some level if this was, as you said, a really psychopathic form of acting out. I believe that this person's mother at one point was a teacher at that school. I mean, I have no idea, but it could be that he wanted to have been one of those little Catholic school children that just fit in and they had this beautiful life, but he couldn't have it, and he was acting out, very violently by just erasing them and then erasing himself. But I certainly don't know, obviously. All we can do is speculate, but I would really like to understand what was going on with his medical panel as well as with his doctor communications, like you mentioned.